Compared to the United States and the United Kingdom, India has been hugely successful in controlling its coronavirus outbreak. How did this country, with such a poor public health infrastructure and more than a billion people living in closed, cramped spaces, achieve something that these advanced Western nations could not? In this video, I'll be telling you 5 exact reasons why India could achieve this, and if you stick till the end, I'll be telling you what India can do further to continue this winning streak. Hi, my name is Ajay. I'm a doctor working in Bangalore, India, and this is the platform where I discuss health and healthcare related and lifestyle related issues. Now, before we talk about India, let's take a look at the data of US and the United Kingdom. So just so that we have an idea, sort of a comparison as to say. Now, there are about 2,839,917 cases of coronavirus in the US till today. That's about 868 cases per 100,000 population, with 129,676 deaths, which is about 40 deaths per 100,000 population. Across the Atlantic in the United Kingdom, however, there are about 284,900 confirmed cases of coronavirus, which is around 428 cases per 100,000 people, with about 44,198 deaths, which comes up to 66 deaths per 100,000 population. Now, coming to India, we have 673,165 cases, which would be around 50 cases per 100,000 population, and around 19,268 deaths, which is just one death for 100,000 population. Now, the data I'm talking about is accurate till the time of shooting this video, which is 5th of July 2020 around 7 p.m. This is a very dynamic situation and the data keeps changing every single day. Now, you might want to shout at me and say, look at the recent spike of cases, it's not being managed well at all. Yes, but let me define what the success here in a coronavirus situation is. Let me put out my arguments, watch till the end of the video, and if you still have an argument to make, post it down in the comments, let's have a debate. Also, I want to point out the fact that I will not be speaking about the economical aspect of this crisis or the humanitarian aspects of this crisis because I'm no expert in that. I'll only be speaking about the health and the healthcare or the government healthcare related issues and the success of the coronavirus situation. Also, I'm not trying to give you a sense of false hope. I'm not trying to, paint a rosy picture. I'm not sponsored by the Indian government or the BJP. I'm just putting facts in front of you and I'm telling you why India has been successful and what India can do to continue being successful. Now, this video is going to be quite long, but it's on a very important topic and I feel it's well worth your time. Now, going to the reasons why India has been successful. Reason number 1, we understood the gravity of the disease and what it meant to the country as a whole. Now, look at Italy. Italy was doing a Hug the Chinese campaign in the first week of February. I know it was done with a good intent of, removing the stigma associated with race and all that. But it was a very dumb move considering how important social distancing and avoiding physical contact is in controlling coronavirus situations. Now, India's first coronavirus case was in Kerala with 2 students who had returned from Wuhan in China. We didn't do any Hug the Chinese campaign. We just did what was right. We put them in quarantine and give them the treatment that was necessary. In my city of Bangalore, when the first coronavirus case was reported in a techie who had returned from the US, 2,800 office contacts were traced and quarantined as necessary. 2,800 people. That's how seriously we took this disease. Reason number 2, India understood the fact that its public health infrastructure sucked and made plans for managing the coronavirus knowing the limitations. India spends only 3.6% of its GDP on healthcare, out of which 2% is from the public healthcare spending and the rest is private healthcare spending. Compare that with the United States, which spends 16.9%, a whooping 16.9% of its GDP on healthcare. And the United Kingdom, with its nationalized health service, the NHS, spends around 9% of its GDP. And India spends only 3.6% of its GDP. So all of the COVID management plans had to be done looking at the infrastructure that existed or could be scaled up in a very short period of time. In fact, just this week, the world's biggest coronavirus treatment facility was started in Delhi. It has 10,000 beds and was built in just 10 days. And also 500 trained coaches were converted into COVID isolation facilities, and this is just in Delhi. Take a look at this report by the CNN.
Biggest COVID care center in the world. Located in India's capital, this facility is the size of 22 football fields. Preparations are on a war footing to complete the ambitious project of 10,000 beds. From manual cleaning of the ground to covering the earthen floors with carpets, installing 18,000 tons of air conditioning and preparing 800 washrooms, at least 1,500 people, including volunteers, have been working tirelessly to meet the deadline. The facility will then be handed over to paramilitary forces. At a time when Delhi's healthcare system is already overburdened, a hospital of this magnitude with 10,000 beds would need a huge workforce of medical staff and security.
Each cubicle will be managed by the personnel in ratio of 1:5. One medics, one doctor and 5 staff nurses, medics and other people. So in that sense, they need to only look after that particular 100 bed or 110 bed facility. They need not to worry about the whole 10,000.
While smaller COVID facilities are being prepared to counter rising COVID-19 cases, over 500 old railway coaches have been converted into isolation centers. These coaches will help increase Delhi's capacity by 8,000 beds. The Indian Army and its medics have been roped in to operate these isolation centers, housing patients with mild symptoms.
In fact, other than a few badly hit cities like Mumbai, Chennai, Delhi and now Bangalore, which are in where the private hospitals have also started admitting patients, in the rest of the countries, most of the cases were managed in the government hospitals itself. Reason number 3, early screening and imposition of travel bans. India started screening all of the people who were coming into India as early as February when the first cases were reported. In fact, India limited a lot of flights coming from China and cancelled all the pre-existing Chinese visas as early as 4th of February. And this was the time when the Italians were still hugging the Chinese as part of their Hug the Chinese campaign. The travel restriction was soon extended to Iran when there was a boom in cases there. Now, US may have stopped a lot of flights coming from China very early on, but the exponential increase in the number of cases in the European states like Italy, UK and France meant that a lot of these Europeans traveling to the United States took the disease there. In fact, this study from the Icahn School of Medicine at Mount Sinai, New York, proves that the New York outbreak happened from cases coming from Europe and not from China. Reason number 4, strict lockdown measures. Now, I can't comment on the effect the lockdown has had on the economy or on the humanitarian aspects, but I can tell you that it has been very effective in controlling the virus. India's lockdown 1.0 started on 24th March with the Prime Minister Narendra Modi going on the national television and announcing a complete lockdown of all non-essential activities till further notice. Now we've had till lockdown 4.0 till the end of May, and even now a lot of places that have a huge caseload are under lockdown. People were not allowed to go out of their homes unless absolutely necessary. The police did a lot to educate people. They did a lot of educational campaigns like these. They literally begged people to stay at home. And where people didn't listen, things got a little bit messy. No large social gatherings were allowed, and instances where it happened, they were heavily condemned, and a lot of them were put in quarantine. Unlike in the US and the UK, where I don't know what is going on through these people's minds, honestly.
If I get corona, I get corona. At the end of the day, I'm not going to let it stop me from partying.
Also, the fact that most of the positive cases were kept isolated in a hospital and not allowed to stay at home meant that they couldn't spread it to other family members as well. Reason number 5, wearing face masks. The WHO directed countries to advise its citizens to start wearing face masks earlier this month. But India had made it compulsory for people to wear face masks in public as early as 8th of April. In fact, even before that, Indians, whenever they were allowed to go out, they were actually wearing face masks to protect themselves. In the US, the opinions are divided. Even though many governmental agencies like even the CDC have advised on wearing masks as early as the 4th of April, there's no clear-cut national guidelines given by the federal government. Earlier, President Trump even announced that he won't be wearing a mask and that he won't make wearing mask compulsory, it is just voluntary. And he even went to the extent of mocking Joe Biden for wearing a mask. But now he has played the reverse Uno card and he says he is all for masks and thinks he looks good wearing a mask. In fact, he said he looks like the Lone Ranger. No, Mr. President, that's an eye mask. That's totally different. Now, I understand that wearing mask could be quite uncomfortable, but it shouldn't be seen as an infringement on your rights or freedom. Look at China. Although I don't trust the data given by the Chinese government, you can say that they've got the virus fairly under control. A huge part to play in this is the fact that the Chinese wear masks all the time. They've been wearing masks for a very long time, and this may have played a big role in controlling the infectivity in China. This is a very cheap and very effective way to control spread of the virus. Please wear it, I beg you. Look at HIV. When condoms were introduced as a measure to stop HIV, a lot of countries, started using condoms, and we could get a very dangerous pandemic under control. But look at Africa. They refuse to wear condoms for reasons known to them. And now more than 70% of all the HIV positive cases in the world is in Africa. Now, coming back to the situation in India, we have seen a lot of spikes after the lockdown was lifted. And you can also say that India is not testing enough, blah, blah, blah. But look at the US. The CDC has said that the total number of cases in the United States is about 10 times as much as the total reported cases. Because nobody is testing enough. Even the United States, Korea, India, nobody is testing enough. But also look at the death rate in India. It is very low. And also in all deaths without a known cause, any suspicious deaths, coronavirus testing is being done. So if a person dies of corona, we will know. But even with all that, India is still on a very good trajectory, and let me tell you why. First of all, this spike in cases was expected. That is what happens when people start traveling around when the lockdown is lifted. We expected a bigger spike, but fortunately, it has been quite under control. Second, we've learned a lot about coronavirus management in this time period that we have, sort of bought ourselves with this lockdown. We now know that remdesivir is quite effective in mild to moderate cases. We know that dexamethasone is very helpful in treating severe COVID cases, and management and treatment protocols have been updated a lot of times in this time period. Third point is that we have built up the resources required, like hospital beds, how you saw earlier, ventilators, at least up to a very good extent. There's no shortage of PPEs, at least to the extent that it was there in March. So we've been doing a lot to build our capacity to fight this virus. There will be an increase in the number of coronavirus patients, but that is not what we are worried about. We are worried about saving patients with COVID, not letting them die. COVID is going to stay here for a very long time, at least till the vaccine arrives. A lot of people are going to get infected. But what we have to look at is how to manage patients with coronavirus better to, prevent them from dying. If the number of cases go up, the number of deaths will also go up. But the number of cases going up, this can be managed only by active participation of the public. Maybe the government can help, maybe the government can put up guidelines, maybe the doctors can put up guidelines. But if the community, if the people don't take an active part in preventing infecting others, staying at home, doing all the social distancing and other measures, this is going to go up. So this is something that the community has to work on. But however, on this part, on the healthcare bit is what I am interested and what I am speaking about, is that we have been able to keep the death rates low. And if this part doesn't go very high, this can be kept consistent, and that is a huge success. And that brings me to the discussion of what can be done to continue this winning momentum. Point number one is that we are going to have a lot of cases, and unlike previously, we shouldn't be admitting mild to moderate cases in hospitals. Hospitals should admit only moderate to severely infected coronavirus patients so that they get the care that is required in a hospital. The ones who are asymptomatic, the ones with very mild symptoms, should be at home with monitored home isolation. These patients must be isolated from their family members even when they are isolated at home. The family members must be taught about the importance of maintaining distance and isolating the patient. The patient should be taught about why isolation is very important to, prevent spreading it to the family members. Large events, movie theaters must not be allowed to open anytime soon. I know this is going to hurt the economy and put a lot of people out of jobs. But who will be interested in partying and watching a movie when their loved ones is fighting for their lives in a hospital? Point number 3, hyper-local lockdowns should be done in places where there are a huge caseloads. You can't shut down whole cities, whole districts, whole states like we were doing before. That is impractical. We have to just shut down the areas which have a very high caseload so that they don't go out and spread it to others. We are at war and we've probably gotten through 10, 20, 20% of it. Until the atom bomb, that is the vaccine, arrives to win us the war, we'll have to continue fighting our battles and making our sacrifices. People have to keep their selfish, petty issues like not wanting to wear a mask because it's uncomfortable aside and work as a collective human family. This is just a small hurdle in our progress as a collective human species, but to jump over a hurdle, sometimes you'll have to take 2 steps back. But at the end of the day, it'll all be worth it. We'll go back to the parks, we'll go back to the pubs, have drinks with our friends again, we'll play sports outside, we'll experience the joy of traveling, of lifting heavy in the gym, of going to our libraries and listening to our favorite artists sing and burn their lungs out. We'll even hug our friends. But how soon this happens depends on the sacrifices that you are ready to make today. Do the right thing. Stay home, stay safe, and thank you for your very patient listening.